Hello, everybody. I'm John Simoes, and I'm here on behalf of Covering New Hampshire and Protect Our Care in a new news series where we're going to look at healthcare, at cost and access here in New Hampshire, its impact on our community, and obviously its impact on our economy. And I'm so happy to have Phil Sletten, the research director at the New Hampshire Fiscal Policy Institute. Well, Phil, congratulations. You have been there almost, 9 years, correct?
Almost 9 years. Yeah, a little
Almost.
over 8 at this point.
Well, Phil, it's great to have you here. You just put out a report on how Medicaid policy changes being discussed right now in the general court could cost the state up to $493 million annually. And I'd like to talk a little bit about that report. It's easily found on the New Hampshire Fiscal Policy Institute's website. But the report highlights that these proposed Medicaid policy changes could cost the state all that money. Can you break down where these costs would come from and who's going to be most affected?
Yeah, so these are all things that are being considered in very early stages at this point in U.S. Congress. So there's right now we just have broad outlines of some of the policies, some of the policy proposals that would change Medicaid funding. And to give you a sense, Medicaid is about 10% of the federal budget. And in New Hampshire, federal funds in total are more than a third of the state budget overall. And Medicaid is the single largest program that the state operates. It's a state-federal fiscal partnership to fund health services, primarily for people in New Hampshire with low incomes, or if you have some form of disability or a certain condition. But almost half the enrollees in Medicaid are children, right? About 48% are kids. So the funding proposals the changes to funding for Medicaid that are being proposed and being discussed in U.S. Congress, and these changes would have to come through congressional action. Right? This is not something that could be done just by the executive branch on its own. These changes are only in broad outline forms at this point, so we don't have a lot of detail right now. But there are two policies for which we do have enough detail that we can make at least a rough estimate of what the reduction in federal funds flowing to the state would be. And that reduction in federal funds depends on exactly how these proposals are implemented and how they're implemented over time. But we looked at two and examined what would they mean if we were to fund the current services that we have in New Hampshire right now in state fiscal year 2025. If we were to fund them with those policies in place, how much would it cost? One of the policies is a reduction in the base match that the state receives. So right now, Medicaid funds 50% on a baseline level of all the programs that are funded in New Hampshire. Federal Medicaid funds 50%, and the state puts in 50%. And you have 50 cents, and that dollar then goes to fund health services for a Granite Stater. There's a proposal that would take away the 50% floor that right now 10 states are at, and that would bring New Hampshire down to 42%, because then it would be based on a formula. And 42% to 50% doesn't seem like a big difference, but when we're talking about the largest program the state operates in dollar terms, it comes out to be a pretty large difference, about $194 million a year, or in this year. And then the second proposal is a reduced federal match for what's called the Granted Advantage Program, or Medicaid expansion. And right now, that's a 90-10 match. And that 90-10 match means the federal government pays 90 cents of every dollar. There is a proposal to reduce that to the base rate. So that could be 50%, or if it drops down to 42%, then we're talking about almost $300 million in cost for that change. So put together, that's $493 million if those two policy proposals were implemented in full in this year with the current services provided. That $493 million would then be money the state would have to come up with to fund those services in an ongoing manner.
Thank you, Phil. Thank you, Phil. So how would these proposed changes change care that's being provided now to lower income New Hampshire residents, and what ripple effects would we see in hospitals and local health care providers and clinics?
That's a great question. So I want to be clear, if the state came up with the $493 million, it would fund current services, right? So the state would have to find those dollars. And if they did, right, if the state government did find those dollars and provided those additional funds to offset the reduced federal match, then there wouldn't necessarily be an effect on services. However, if the state doesn't find those funds or only finds a portion of those funds and services are scaled back accordingly, then we could see some fairly significant effects. Probably the most significant change that would happen under current state law is if the federal match for the Medicaid expansion program for Granted Advantage, if that's reduced below 90%, then under current state law, the state immediately ends the program with 180 days.
Wow.
So without that law changing, if that law were triggered, then that program, which serves about, as of the end of last year, about 59,000 granted staters with low incomes. So these are individuals, adults age 19 to 64, could be parents, right? There could be on their own household, or they could be together in households with children. That enrollment is about 59,000 people in the state. You have to have 138% of the federal poverty guidelines or less, which means you're in poverty or near poverty. And those 59,000 individuals would have to find coverage somewhere else, whether that, or they would go uninsured. And that's where we get to the effects on the broader healthcare system in the state. Because when people don't have that reimbursement, they don't have coverage, they may not be able to pay for their for healthcare needs. And if they don't have that coverage and providers don't have that reimbursement, the healthcare system doesn't have those dollars flowing into the state from the federal government, that means that there's probably cost to the system elsewhere. And there may be providers who have much more trouble providing care, especially in a preventative way for individuals who might not be coming for preventative care. So they may have more drastic needs when they arrive, or more acute needs when they arrive, or they just aren't able to pay for any of those services, and that means that the providers need to find other ways to make up those costs.
Thank you, Phil. So how likely is it that these changes will happen, and what policy solutions or strategies should we talk about now to mitigate the impact of the changes? Should they be enacted? Are there steps that state lawmakers or healthcare advocates should be considering to protect access and also the stability of our healthcare system?
Yeah, it's a great question. And to the stability of the healthcare system piece, this is, Medicaid in total brought in $1.4 billion in state fiscal year 2024 in federal funds flowing into the state. So again, that's money that supports providers, supports individuals' access to health services. At this point, we don't have very many details. Again, there are several policy options that are on the table that are being discussed, and most of those, or most of the changes that would be substantial changes to Medicaid funding, would have to move through Congress. So we'll get more detail as there are actual federal policies, federal pieces of legislation that are proposed and then eventually implemented. So right now, there's only so much that policymakers can respond to because we only have the broad outlines of things that could happen, right? This is far from a certainty at this point. That being said, any of these changes to Medicaid would be pretty substantial in terms of their implications for the state budget in New Hampshire, for coverage for individuals in the state, or a combination of both. And that mix of possible impacts is quite substantial, whether it's phased in over time or happens suddenly, or doesn't happen in any of these forms we're discussing. It's something that is very worth watching. There are some things that policymakers could prepare for when it comes to planning for the next state budget or the state budget after that. Right now, there are a lot of fiscal pressures on the state. There are other competing priorities for state dollars. And there are, policy changes that, could make the timeline a little bit longer in terms of responses. For example, the funding structure for the Granted Advantage program in New Hampshire, and the trigger that would end Granted Advantage. If that's something that policymakers see happening relatively quickly in Congress, state policymakers may want to look at those and consider whether changes to those policies could give them a little bit more time to respond if there are federal changes that happen quickly.
Well, thank you, Phil. It sounds like there's not only a lot of money in play, but a lot of people's well-being and health. I know you'll be watching this and coming back with more information as things move forward in Washington. What else are you watching as we move forward with healthcare right now? What else are you looking at?
Yeah, so especially to the extent both with Medicaid and with other public health services, in the state budget is facing a lot of pressures currently right now. There's revenues are down. The state has repealed the interest and dividends tax, so that's going to make revenues lower in the next budget biennium. And right now the state is also facing some lawsuits associated with both the terrible things that appear to have happened over the last several decades at the Youth Development Center and for youth who are nominally in the state's care, and education funding. These are all big variables that are going to impact the next state budget. And any one of those variables would make this sort of a tight budget situation. Depending on how all four of them interact, we could see some changes to services in the state, regardless of what happens at the federal level, that could definitely affect the health and well-being of Granite Staters.
Well, thank you, Phil. Thank you very much. Phil Sletten from the New Hampshire Fiscal Policy Institute. We will talk again. Thank you for helping us bring some clarity, although a little disturbing and very worrisome. It's been an interesting few weeks. It's nice to catch up with you. Thank you for all that you and your colleagues do.
Thank you for the opportunity. I really appreciate it.
Well, on behalf of Covering New Hampshire and Protect Our Care, I want to thank everyone for listening, tuning in. Follow our YouTube channel and follow us on social media for more news and updates. And meanwhile, stay healthy and be well. Thank you, everybody.